Here is Vivek Krishna Tankha for you. Good evening, sir. Welcome.
Good evening. Can you hear me?
Yes, sir.
Thank you, Mr.
Yes,
Sukumar.
yes, sir. Yes, sir. Go ahead, sir.
In fact, I was pleasantly surprised when Ravi called me the other day and he says, Vivek, he's my batchmate. We were governors together, Ravi Vadlamani. And he says, Vivek, you have to speak to and address Rotary Club of Bangalore. I said, isn't this one of the oldest Rotary clubs of India? They said, yes, 1934. I said, my club is 1939. So I'm from one of the oldest, but you are older than me, of course. I'm a second generation Rotarian. My father died in harness. He was a high court judge, but a Rotary president, a Rotary governor. He was Rotary governor in 74, 75. And I imbibed a lot of things from him. My three idols in life are Mahatma Gandhi, Mother Teresa, and Martin Luther King. I mean, they are the people I would love to follow. And I must tell you that I joined Rotary in 82. Once after my father's death, I was selected to go as a GSC team member to US, came back and became a young Rotarian in 1982. But from 82 to 96, I was a professional, fully immersed in my practice and decided, and when I became president in 1996, that was the time a new journey in my life began. This journey has not come to an end, it's still going on. And the journey started as a president, continued as a governor, and continues as a past district governor. I must tell you only one thing, which I must mention, that as a president, I like to take up challenges which I think are not achievable. And I put all my resources, all my friends, and all my well-wishers into it. And normally I find that at the end of the day, we do achieve what we have thought. So as a young president, I thought my challenge should be to start a school for special children. And in 1997, which school continues till today, Justice J.F. Verma, as Chief Justice of India, came to inaugurate this school, Rotary School. We still have the school, and we have 4 other schools in Bhopal, Gwalior, Mandala, that's a tribal school, and Chhattisgarh and Bilaspur. And practically every district in Madhya Pradesh and Chhattisgarh had been requesting me to start the school. That is one of my ambitions, to have a Rotary school for special children, which of course have put it in my father's memory, in every district of Madhya Pradesh and Chhattisgarh. I became a district governor then in 2001, 2002. And then, while as a district governor, I went to Singapore and I saw a film. They showed us a small film on a documentary on Raja Sabu and Ushaji. Rajaji and Ushaji were doing their medical missions in Africa. And I would see them carrying patients on their shoulders. They went with their team from India. They stayed in for 14, 15 days in Africa, in the wilderness, in those unheard of countries. And I started turning to myself and asking Rajaji that, when you're doing such a great work outside India, why can't you do it in India? Rajaji said, of course, Vivek, we can think of India. And that is how the health initiatives began in our district. It started with Kalahandi, where I was not a part in Odisha at that time. But Rajaji didn't have a very good experience. The administration was not too responsive at that time. So he asked me, he says, Vivek, are you sure that your administration will support us? I said, sir, I suppose so. So that is how we had the first health mission. And we nicknamed it Rahat. Rotary's active hands are touching. Now, Rahat mission today has reached out to at least 500,000 patients. 500,000 patients across 2-3 districts, mostly our district and the neighboring districts of Gwalior and Indore. The numbers would be 3053 and other would be 3080 at Chandigarh and 3040. So all these districts with some foreign districts would combine, and we would have a Rotary mission every year, starting from Mandla in 2010. That was our first time that we engaged into a mission like Rahat. We did a lot of preparatory work before the mission began. Our Rotarians, friends would travel to Mandla, talk to the district administration. I would be pushing the state administration to help us. And finally, it began. It was a 6-7 day mission. I remember 2010. And I clearly remember that we had planned for 1,000 to 1,500 patients a day, 1,000 to 1,500. And maybe total surgeries of 2,000 or 1,000 and processes, of course, in those 7 days. On the first day, to our shock, we had 10,000 patients. I had about 150 doctors with me that day, and we were falling short. I didn't know what to do. But my friends of the state government, the secretary, the chief secretary, the health secretary, they happened to be there that day on the first day. They got into the act, and by next morning, we had 150 additional government doctors there to help us. And that mission in 2010, which was one of our best missions, ended with roughly 50,000 OPDs and 5,000 surgeries and procedures. Now, when I say 5,000, all surgeries do not take place at the time of the mission. We take over all the private hospitals, but we can't operate everybody there. So the serious surgeries take place in the bigger hospitals of Jabalpur. That time it was Jabalpur Medical College and big hospitals of our Rotarians. After that, we traveled from Mandla to Jhabua, to Neemach, to Vidisha, to Jagdalpur, to Dhamtari, Shahdol, Morena, everywhere. I mean, we were different districts also. We had Rahat missions. Everywhere, we never had less than 30,000 people in the OPD, and always more than 2,000 surgeries and procedures. Somewhere it would be more also. But the mother of all missions took place in November 2019. That was again in Mandla after 10 years. Because Mandla, if you come and see Mandla, it's a completely tribal district, surrounded by tribal districts also. And all our missions have been in tribal areas. We've selected tribal areas for Rahat, always. And in Mandla, the last mission, which was from, I think, 7th of November to 14th of November, if I recollect the dates correctly, we touched 1 lakh number of OPD. And we had something like 5,000, I don't know how much, 5,000, 10,000 surgeries and procedures, but this went on for 6 months. The mission doesn't end with those 6-7 days. Every person, every patient who comes to that area is not only examined, but also treated later, if not there, whatever be the treatment. And believe me, this time in Mandla, I was not alone with just doctors of Jabalpur or surrounding areas. This time we had doctors from whole of Madhya Pradesh and whole of India. People like Dr. Trehan, Dr. Guleria send their teams. So for some of our missions, they come themselves also. We have the best of hospitals supporting us with their teams, whether it be Vedanta, whether it be AIMS, whether it be Gangaram, Max, Choitram, Indore, Aurobindo, Chirayu, Jabalpur Medical Hospital, all the medical colleges. So in total, we had nearly 776 doctors, I think, if I remember correctly, and doctors and their paramedic staffs. And these people, most of them stayed there for 7 days, but many of them would come for 2 days, 3 days and go away. Like Bombay Hospital, which sent its team of specialists, was for 3 days. Just Lok sent its team of doctors for, I think, 2 or 3 days. So we make sure that the kind of patients who must see these doctors come on that day. So it's a huge arrangement. It starts with pre-diagnostic camps, which are spread over the villages, where government doctors and Rotarian doctors go and see these patients in their villages, examine them, tests are done, and then they are pre-selected for the camp which is to be held. But what happens is, when you have a camp of this dimension, 50% would be people who are pre-selected, but 50% would also be people who come on their own. And they come from distant places also. They come from far. I mean, this time in Mandla, we had people coming from 200 kilometers and 300 kilometers. We don't want to, we treat everybody. We don't want anybody to be disappointed. So we treat everybody who comes there. We give them dates if they can't be operated there. And you can't imagine that it's the level of the preparation that takes place. The registration counters, the OPDs, and we have that OPD is generally in a big dome, depending on the size of the camp. And this dome is a thing which the state governments always did for us. But the doctors were ours. Partly also state government would get 2 doctors to help them. And these doctors would then sit from 8:30 in the morning till about 6, 7 in the evening. The surgeons would, of course, continue till much later. Some of the surgeons would leave surgery and come and select their patients also in the OPD. So it's a huge operation. The Rotary takes care of the logistics, while we receive our doctors who come from different directions of India also. Even doctors who come from Jabalpur and surrounding areas like Bhopal and Indore, they come as our guests. We treat them as our guests, we host them. The food is taken care of by the Rotarians. The transportation, everything is taken care of Rotarians. In between, the government was kind. They said, since you're, Mr. Tankha, you're not doing for yourself, or Rotary is not doing for itself, it's doing for us. So we would like to treat your doctors as state guests. So sometimes they were also state guests. So government was helping us. So this partnership that I'm talking about is not a partnership which can be done alone. It has to be a public-private partnership model. And as Monte Carlo once told me when we were showing these films in Delhi, in Murti, he says, this is one of the finest public-private partnerships that I've ever seen in my life. This partnership also gives right to a lot of other things. In most of these districts where we've had these tribal districts where we have these camps, also led to a establishment of a blood bank. We have now Rotary blood banks in Jabalpur, Narsinghpur, Shahdol, Chhindwara, I'm forgetting more names, at least in 5, 6 districts. So one leads to another. Then these schools for special children, the Mandla School for Special Children came because of the camp. So you can imagine what is the level of preparation and what is the level of work. I mean, my doctors who came from Rotary doctors and other doctors who were there for the on the gynec section, they said when they examined the tribal women and they realized that they all need to be operated because the uteruses were in a very bad shape. You can't imagine with 5 or 6 hemoglobin, the doctors took a chance to operate these 300, 400 tribal women because they knew that if they don't operate them now, possibly they will not get a chance later. And believe me, we are so careful about everything. I'm so grateful to God. We've never had a mishap in any of these missions. And you can imagine the kind of care that we take in these missions. When Raja Sabuji and Ushaji themselves are with me, hand in hand. The whole day we are taking rounds of the hospitals, the OPD, with me, the top government officials, with us, the promoters of most of these hospitals also turn up and take rounds. So as I said, it's a huge partnership that takes place. Rahat is not an individual act. Rahat is a public act. It's for the poor. It's for the unreached. And not only that, I mean, like Sharof Eye Hospital, Delhi, they have every Rahat in these 10 years. They've been part of it. I request my collectors that get all the children, tribal children living in the dense forest who can't see, who are visibly impaired, get them to the camp. They would get them to the camp, 30, 40, 60, 80, depending on the number. Then these children are examined. And they select some of them because they feel that some of them could have advanced surgeries in Delhi or Bombay, and they could get their eyes restored. And it's happened. It's happened. We took 30 children. We identified them. We take them, Rotarians take them by train to Delhi. That's where President Kalam came in. He found the whole aspect so touching that not these children, but another bunch of children. He made special arrangements from them. And finally, I must tell you, after each round of surgeries, which they would do in Delhi or Bombay, and some of them are Rotarian doctors, they would not even charge. Dr. I think Muscati from Bombay, if I remember correctly, that's his name. He would travel to Delhi only to operate these children. Dr. Rao from Hyderabad were taking special care of these children on the request of the President of India. So what I'm trying to say, when you do a thing like that, the world joins you. You don't, I mean, you only start a thing. But when the world joins you, but there is a lot of preparation. The preparation starts at least 6 months in advance. But when you end with, when you end with it, I would only say that you feel very satisfied. You feel that there was nothing better that you could have done in your life than to serve the people who otherwise may not have received the kind of attention and care which we were able to get them. And believe me, they don't pay a pie, either at the camp or when they go to these big hospitals. Rotarians would look after them. We even buy the tickets to go to Delhi or Bombay. So, as I said, Rahat, in a sense, is continuing today. Every year we have Rahat, but last year we couldn't do it because of COVID. So now we've decided. Shekhar is a great man that way. He came for my last camp in Mandla. He was there personally. So Shekhar says, Vivek, why not do Rahat again, but not only your district, but all India. So we announced, we said, yes, let's all join hands and do Rahat from Kashmir to Kanyakumari and from Kutch to Kohima. We have 38 Rotary districts. We have 2 lakh Rotarians. We'll all join hands. We'll all come together, do something which nobody has ever done before. And this is what I meant today, that the meeting, my coming here is only to tell you that if your district or any district maybe for that matter decides to come forward with this initiative, people like me, and there'll be hundreds of people like me, would readily join you to be hand in hand to take forward such projects, because there can be nothing better than this in post-COVID India, because other diseases have not been addressed. This is the best time to come forward with a pan-India Rahat. And if you can think of a Rahat, I can only feel blessed. But all this is not possible, Rotarians, if you don't have a supporting wife. I would say my family, my wife has been a great support, Aarti. And in every camp, she's my support. She's always with me. She's serving the patient with Ushaji. Normally, she's part of Ushaji's team. When I started the school for special children in the Rotary Club of Jabalpur, I was the advocate general. I would go to office. She would go to the school till we, of course, shifted to Delhi in 2003, 2004. So as I said, the Rahat will never end. It should not end. But let's take it forward by joining hands. Thank you.